Good afternoon, everyone. Thank you so much for being here with us today for our 30-minute webinar on how to effectively change behaviors. My name is Julie Mallory, and I am the Events Marketing Manager here for WebMD Health Services, and I will be your moderator for today. Before we get started, there's just a couple of things I wanted to cover. This webinar will be recorded, and everyone who registered will receive a copy of the recording so you can go back and listen to it, or you can share it with your colleagues. So just be sure to look for that to show up in your inbox here in the next few days. And then we're also going to have a few polling questions throughout this webinar. It's a fun and interactive way for you guys to participate, and we hope that you will. And then we're also going to have some time for a little Q&A at the end. If you have a question that comes up during the webinar, please feel free to ask it at any time. You will see the Q&A box, and if we are unable to answer your questions during the 30-minute webinar today, we will be sure to follow up with you guys after. And then also at the end of this webinar, there's going to be an opportunity for you guys to give us some feedback on the content that we've shared with you today. And we just ask that you guys take a moment and just answer a couple of those questions. This feedback provided will be used in developing our next webinar. All right, so let's take a look at what we're going to cover in the next 30 minutes. We will go over the impact of modifiable behaviors. We will talk about the power of habits, and then the top 3 behavior change drivers. Finally, we will wrap up with an introduction to WebMD One, which is our brand new consumer-first well-being experience. So for those of you who might not know who we are, just a quick introduction to WebMD Health Services. So we have 17 years of experience driving positive behavior changes. So consumers trust WebMD for reliable, accurate, and clear answers to meet their most pressing health-related questions. At WebMD Health Services, we tap into these valuable consumer insights to design and implement successful, engaging solutions to help individuals meet their well-being needs. We understand that there are numerous paths to reach well-being goals, and our expertise combined with a variety of third-party partner integrations enables us to deliver unique and personalized experiences across a wide range of industries. Now that we've got all that out of the way, I'd like to introduce you to your speaker for the next 30 minutes. Dr. Mike Sokol joined WebMD Health Services as our Chief Medical Officer back in 2016. He is a physician executive with over 20 years of professional experience, primarily in large healthcare corporations. And Dr. Sokol works with WebMD Health Services product development team to provide the vision and strategy and plans for the company's products and services. He oversees an advisory panel of leading researchers and clinicians focused on delivering new and engaging well-being solutions for the employees and members of WebMD's clients. Dr. Sokol is also responsible for the clinical quality and accreditation of our condition management programs. Hi, Mike.
Hi, Julie. Thanks for that kind introduction.
Absolutely. Thanks for being here with us today. So just a reminder for everybody that's listening, this webinar is only 30 minutes and we have a lot to cover. So with that, Mike, let's get started.
Okay. Thanks again, Julie, and welcome everyone. Thank you so much for joining today's webinar. The first item that we're going to cover, as you can see on the slide, is the impact of modifiable behaviors. So we know that medical care does account for the majority of the $2 trillion or so that we spend annually in healthcare, and we know that a large percentage of that is used to treat preventable chronic illness. And what you can see on the slide here on the left-hand side is the amount of money that we spend per person for employees that don't have a medical condition that's attributed to a large number of lifestyle-related healthcare risks. You can see it's about $761 per employee. And we can see for people that have a pre-existing medical condition that those costs associated with these lifestyle-related modifiable risks is much larger. It's almost $2,600 per employee A large percentage of this is related to obesity. Unfortunately, we know that there's a large obesity epidemic in the country, and a lot of that is related to obesity and overweight. So a lot of the behavioral change that we're going to focus on is really important when looking at these costs, right? We know that there's a lot of costs associated with it, and so we can get people to change their behavior and reduce the likelihood of illnesses related to these lifestyle-related risks. It really can make a large impact. So we want to next talk about the power of habits. So before we get into the specific behavioral changes, I think it's important to talk about the issue of habits. Basically, we know through a study done by the National Business Group on Health that habits account for about 40% of our daily behaviors, and they're not necessarily stagnant. So we know that people can change their habits, and when you look at what habits are, in fact, there are three elements that make them up. There's something called the cue, the reward, and the routine. And so we know that every habit is actually initiated by a cue or a trigger. It could be something like an emotion or a sight or a smell. The routine is then the actual behavior that someone engages in, and the reward is the benefit that somebody gets by doing the behavior. So it's important to really analyze and look at these different elements in order to understand how individuals can begin to alter or stop these bad habits or to create newer positive ones. So this is really an important issue, is if there's an opportunity to be able to alter people's habits, especially for those things that are not really related to healthy activities, then there's really an opportunity to make a difference in improving their health. So we know that in terms of well-being programs that we really need to go beyond the basics to be successful. We need to develop programs that are user-friendly and intuitive, and also well-designed and engaging for people. So we want to be able to make a program that is going to have meaning and benefit, and most importantly, really be personalized to them. And so with that, I'm going to turn it back to Julie to actually ask our first polling question.
Great, Mike. Thanks so much. Okay, so this is your chance for all of you guys listening to participate here in our webinar. So the first polling question is, does your current well-being program focus on changing habits? Yes, but I think there's room to improve, or no, I would like to learn more. These are the only two choices, so pick the one that is best suited for you and your program. And take a minute. All right, let's see what you guys had to say. All right. Yes, but I think there's room to improve. Very interesting. Mike, what do you think about that?
Yeah, I think that is interesting, and it's actually a little bit higher than I would have expected. So I'm happy to see that because we know that, again, changing habits for employees is really a key focus on making programs that look at holistic well-being to be more successful. So I'm really glad to see that the majority of folks recognize the importance of doing this. So that's really good, and it really leads us into the kind of the core of our presentation, which would be the top three behavioral change drivers. And, you know, it's really important to focus on these because it has a large role in doing these types of programs. So the three that we're going to go into are intuitive motivation, which is what we're seeing on the first slide here. And then I'm going to talk about setting specific and incremental goals, and then we're going to talk about feedback on accomplishments. So those are the three, and on this slide, again, we have the first one, which is intuitive motivation. And basically what that means is we want to ensure that any program that's being developed or program that you're working on has clarity and specificity on what's possible. We know that too much information can lead to what we call decision fatigue, and it can make things overwhelming for people. You know, decision fatigue is basically when you offer too many choices. So it's good to have choices, but if you have too many of them, individuals can become overwhelmed, and it makes it difficult for them really to make any kind of decision. So it's important to make sure that you offer a good variety of choices, but not to overwhelm people with a number of choices. In some cases, too, we note that it's often helpful to have a preferred choice as a default. So when people are having a difficult time deciding what to do, sometimes it helps to give them a clear direction on what a default choice would be. Now, having said all of that, with having too many choices, it is still important, though, to make sure that you are promoting choices within the programs that you have. So you don't want to completely eliminate the ability for somebody to choose, the path that they want to go on. Behavioral science has shown, in fact, that allowing people to select what they want to work on can really increase their satisfaction. So it's not having too much, but certainly having enough choice that makes a difference, and then clearly providing reinforcement that these behaviors can change. So people need to understand that there is an opportunity to make change, that you want to encourage appropriate change, and again, providing the necessary reinforcements to do that, would really be important. So when we go to the next, the second of the three behavioral changes, here we're talking about meaningful goals. And when we're saying here meaningful goals with incremental progress. So creating goals that are achievable allows employees really to gather momentum through small wins instead of one big win. And I think that's really important as well, is that you really want to encourage people by showing them that just making small incremental changes to change their status quo can really make a big difference. Science has shown that it's easier for people to continue with the behavior than to change that behavior. So we want to make sure that leveraging these small steps can really make a difference. Clearly, again, you want to make sure that the goals are achievable. Sometimes people can get overwhelmed when they see what has to be done, and so making sure that the goals are easy to understand, that they make sense for them, and that they're really personalized. And that's really the third bullet there when we say meeting them where they are. Basically, it's trying to make sure that you understand what are the needs of that individual, making a solution that's personalized and providing that individual with the tools and the resources that he or she would need. What we've realized is that, the one-size-fits-all really doesn't work very well. And as we move forward with these types of programs, we want to make sure that we understand what the needs are of the individual and tailoring something for that individual. And again, doing it in a way where it's not overwhelming. So I think a good example of that is if you have somebody that's been leading a sedentary lifestyle and they really want to start engaging and ultimately, running a marathon, well, they're not going to do it right away. It's more likely they're going to do it if they at least start by doing some walking, each day, and then doing some running, and then ultimately leading up to that marathon. So it's good to have an ultimate goal in mind, but making sure that people understand the incremental steps that they can do on the way to achieving that goal. And so that leads us to the third of the three behavioral changes that we're talking about, or the drivers, which is really to celebrate the accomplishments. So, people have now understood that there has to be motivation to do something. There has to be meaningful goals with incremental progress. And now the third aspect of this is really what we're calling celebrating accomplishments. One of the key principles here is providing people with immediate reinforcement and feedback on the wins that they're achieving. A lot of times when we do these types of programs, sometimes there's ultimately a one big opportunity to win a reward or to get feedback, and we want people to stay engaged over time. And if all we're doing is just focusing on that one big win or reward, sometimes it's not as motivating for people. And so I think what's really important here is to reward people along the way, not just do perhaps one big thing at the end of the program, but do things all throughout the program. So, we want to make sure that we're motivating people and really giving them a sense of possibility. And so, again, it's also creating this positive reinforcement so people see that what they're doing is meaningful and they're getting rewards for doing that type of behavior. And it's really allowing people to feel that they've completed something within a larger program. So integral to helping people stay motivated is allowing them to feel a sense of accomplishment. So it's, giving them that positive reinforcement that what they're doing is really making a difference. So with that, I'm going to turn it back to Julie to ask the second of our polling questions.
Thank you, Mike. Okay,
Sure.
everybody, so here is your next chance to participate. The question here is, do you think your well-being program can benefit from incorporating these behavior change drivers? Yes, I'm going to start working on those now, or yes, but not right now, maybe in the future. Again, these are the only two choices, so just take a second and select the best answer for you, and we'll see what you guys had to say. All right, let's take a look. All right, they're going to start working on these now. What do you think about that, Mike?
Yeah, I'm really excited. And this, it's really important to have behavioral science and behavioral change within these types of programs. And the fact that the majority of folks are saying that they are going to start working on this. And I'm sure a lot of you have already been doing this as well. But it's really good to see that and understand that there is a clear science behind these types of programs. And so it's really exciting to see all of you recognizing that. Okay, well, with that, Julie, I think we'll turn it over to Alex to talk a little bit about the WebMD-1.
Great. Thanks, Dr. Sokol. I'm really excited to show you guys really a quick demonstration of the next evolution of our engagement experience, and we're calling it WebMD-1. The idea behind WebMD-1 is to really find a way to provide, a truly engaging experience and making sure we're providing relevant information that's meaningful and really starting to drive that habitual use. Tying back into the concepts we just walked through. I walk around and I see people with their faces in their phones all day long, and we want to make sure these well-being offerings and how we're promoting things are part of that habitual use. And the drivers behind why people are coming back and using things frequently is because they are seeing that meaningful information, it's relevant, and it's really an intuitive experience. So as you go through the demo, I'm going to really sprinkle in some of those areas, and really related to what we just saw in the webinar. So for WebMD-1, the demonstration here is going to be from a mobile device, but it is available from desktop experience, responsive through a browser as well, a mobile browser as well. But in this example, it is going to be a mobile app experience. Our user, Alex, she's already has an account with WebMD before, but this is really her first time coming through the WebMD-1 experience. And part of this is we want to be able to begin the experience by collecting some information about her to provide that personalized experience. We don't need to gather yet a full health assessment response to gather all that information. We want to learn some just quick things so we can start to build out that personalization. So we ask some background questions about her. We ask her height and weight. If we've received this through biometric screenings, we pre-populate this, but in this case, she's going to self-enter her height and weight, and then answer a question about how she would rate her overall health. The next piece is really beginning into one of the three main areas that we're going to drive the personalization and relevancy. We want to be able to balance understanding what the consumer wants to work on. What are her priorities? In this case, Alex wants to work on reducing stress, getting to a healthier weight, and improving her mood. The other piece we want to balance is, it doesn't matter how many of the things she wants to work on herself. Based on her conditions and other areas, we know she has some clinical needs. So we're going to ask her what her conditions are. Alex actually has just recently been diagnosed with diabetes, so she indicates she has diabetes. If we received claims data, or if previously through the health assessment she's reported that she has a condition, we would use that information as well. But through this intake, we now know that Alex has diabetes. We then start that personalization process to drive this experience, and now we're on really the home page for Alex. You can see we started to build out, and really present relevant information. We have a couple areas where she could navigate to around diabetes, which was her condition, stress and mood, which was the interest that she had, as well as weight, which was another one of her interests. The other area that we're balancing as we kind of build out these prioritization and these recommendations is, we already talked about the individual's interests, those clinical needs. We also know from an employer perspective, you have priorities and things that either you want to promote or focus on. One of those things that you usually drive for for the focus areas is around how you built out your incentive program. So we can start to see here we're showing some recommended next steps, and we're promoting that there is an incentive program available. Alex can click in to find more information about that. But we start to present areas where we have a recommendation for what is an appropriate next step for Alex. In this case, because she has diabetes as a condition, and we know for the incentive program that she has available to her that she actually could earn rewards for diabetes, we really surface and want to promote that she can actually begin and set a goal with one of the WebMD tools around managing diabetes. We're also seeing down here that we're presenting some content. I think most of you, when you think of WebMD, you think of the webmd.com and the content. So we do want to make sure we're bringing in our rich amounts of content that we have available and really presenting that from a personalized basis. The other thing I did want to touch on is as we go through this, we do want to balance from that seamless perspective, whether the things that we're presenting, it could be a combination of WebMD tools and services, but also later in the demo, we'll see some examples of when we bring in WebMD has some preferred partnerships for other offerings, but as well from an employer perspective, we know that all of our clients have various programs they're working with, and we want to be able to combine and incorporate and promote those things seamlessly. Alex is going to go ahead and actually set a goal about diabetes, and this is a WebMD tool, our condition management digital health assistant. I won't dive in too much regarding this specific tool, but just highlighting some areas related to what we just talked about in the webinar is providing some clear examples of those incremental goals. It's not the goal here isn't just be perfect, right? We're asking some quick questions around what can you do to eat on track? Are you having the right amount of exercise, and you're taking your medications? And the person, Alex doesn't have to track all those every day for her to earn the reward or earn the goal. We really use a model where she starts the goal on track, and she interacts and interfaces and says she's completed certain tasks that are daily items, other tasks that she should complete once, for example, getting her flu vaccine. That will incorporate as part of her overall progress. And she could miss a day, maybe not do all three things on a certain day, but she will still maintain that progress. And that goes back to that concept of driving that engagement through setting really reasonable goals and not making it a huge hill to have to climb up, and very incremental kind of changes that she has to make to make progress towards that goal. Once I go back to the home page, one of the other pieces around kind of driving that habitual use is making sure that as Alex opens up the app, we're changing things up. So she's not seeing the same information over and over. So you can see here, based on some interactions, we're now recommending other items to her. She has a wellness challenge that she can attend. She can set a goal around her weight. So again, making those changes, and that really drives that habitual use of, when she pulls it up, there is valuable meaning information, and it is changing over time. The next, for the next example, Alex is walking around. She sees that she gets a push message, and she actually has received a message from a WebMD health coach. WebMD Health Services has telephonic health coaches, but we also, through telephonic, they can also send secure messages through this chat functionality as well. Alex has been working with her coach over time, and they've been talking about her stress, and she's actually been letting her coach know that she signed up from Equilibrium, and she's actually enjoying that experience. You can see here her coach is providing her some reinforcement that it's great that she's been working on that, and then that she should actually continue to use that program to alleviate her stress. Tying back into some of those concepts from the webinar, here's another example of providing that reinforcement, right? We saw earlier in the tool, and if you notice, when we completed the task, we said congratulations for completing your daily task. Not only is kind of that programming from a digital perspective, even our telephonic or human coaches who are writing in these chat messages, they're using those same concepts to make sure we reinforce those positive behaviors. Alex is going to navigate over into one of our paths around stress. So before we were really working from that kind of home page, but we also have these paths. And so the categories, if you recall, around diabetes, stress, and weight. And this gives us another opportunity to provide some personalization specifically around this topic. Because we know she's interested in stress specifically, we can show some of our tools, but as well as promote that we do have, in this case, a preferred partnership with Equilibrium, and she can check in with her tool. She clicks on that, seamless access over to the Equilibrium app, uses one of their tools to work on her breathing exercise, And when she comes back to WebMD, we're sharing information in real time. We're now, because of this, she can earn rewards for interacting with Mequilibrium. It is reflected in her reward status. So touching on one of those other concepts that Dr. Sokol brought up, about the immediate gratification or satisfaction of once you complete it, we do reflect it in our system. The last thing here, just reinforcing the concept that on this homepage, we are making updates so that it stays fresh. We now are promoting a wellness challenge that we have available. Invitational is a WebMD challenge we have, as well as that she can have a biometric screening. So that just provides another example of that balance that I mentioned earlier, understanding those individual preferences, the interests from the consumer, the clinical needs they have, as well as those employer priorities. And that's really the end of the demo for the WebMD One experience.
That's great, Alex. Thank you so much for that. We appreciate it. Now, we've just got a few minutes left here before the top of the hour, and we've got some questions that have come in. So, Dr. Sokol, I just want to take a few minutes and just ask you just a couple of questions here. The first one is around leadership, and they want to know, how do I get leadership on board with the idea that behavior change needs to be a priority?
Yeah, it's a great question. And, the first thing that really has to be done is to make sure that leadership understands the value of doing a well-being program in the first place. So my experience has been that it really starts with putting a solid strategy together and a business case for why an organization wants to engage in a program like this. Presenting it to the leadership, getting them to understand the value, telling them what you think you'll be able to achieve and what the benefits will be, not just for the individuals, for the employees or the members and their families, but also for the company as well. And so it really is having that business case. And as part of that, it's incorporating these principles of behavioral change to show leadership that by getting people to engage in these types of behaviors, that there really can be a meaningful difference in doing it. The other thing that I found in my experience as well, Julie, to make this to be even more successful is having leadership lead by example. So once they buy into this and understand that incorporating these principles needs to be part of the core strategy in order to achieve meaningful outcomes, it's also important to get them to understand that they need to play an active role. And if they can show the employees that they're exercising, they're eating healthy, they're engaging in these types of behaviors, then I think it's much more likely that the employees will participate and ultimately see a benefit to the organization as a whole.
That's great, Mike. Thank you. One other question here around remote employees. So do the 3 drivers that you mentioned apply if you're trying to reach remote employees?
Yeah, that can certainly be a challenge for organizations that have employees at remote. Sometimes they don't have as much access to all the opportunities or to all the programs. Again, from my experience, having been in a company where we had a large number of remote employees, it certainly was challenging, but we did find ways to try to reach those folks. And so whether it was through means of, let's say, the internet or electronic, or sometimes through mailings, or even, having coaches or others that can go out in the field and be with these folks. Or let's say, for example, if there's an on-site gym at the corporate headquarters, but people in the field don't have access to it, giving them a chance perhaps to join a gym in the neighborhood or in the local area. But I think it's important to note that while there are challenges with how to engage or reach remote employees and give them the same opportunities, I would say that the principles that we talked about today, behavioral change and behavioral science, definitely do apply equally to those employees. So I would say to those on the phone listening that I wouldn't let the challenges of how you intervene with these people impact the opportunities to engage them with the behavioral science principles. So again, whether it's through electronic means or mailings or in-person ways or other ways that people can get involved in the community, it's important to make sure that even with remote employees, that they understand the principles of setting realistic goals, again, giving them the opportunity to do small incremental activities, giving them positive reinforcement along the way, and so making sure that all of those principles apply equally to them as well, because you want those remote employees to feel that they're part of everything just as much as everybody else in the organization.
Absolutely. Great point, Mike. Thank you. Okay, so we did have a couple of questions we didn't get to. As promised, we will follow up with you guys after this webinar and answer those questions individually. We are at time, and we want to thank you all for being here. And thank you to Dr. Sokol and Alex Nguyen for being a part of our webinar today. Thanks, everybody, and have a great day.